So, good morning to everybody. And actually, it's a rare opportunity to make conversation in between doctors and among the doctors. I believe that learning is a continuous process, and most probably we have to learn from everybody. And as it's a clinical approach, Dr. Bora has told repeatedly to give some clinical tips, and I am treating lot of patients, that much I can say, with lot of failure. Everybody tell they are success, but still I criticize only my prescription, why this patient is not getting cured. And for this reason, here I come, or I got the opportunity to deliver in front of the learned, respected and beloved brother and sister of the family members of the homeopath. So, there are so many approaches. As all of you are doctors, and most probably you are trained in some way, I am trained in some way, but basic difference why we homeopath fails in clinical practice, we should ask ourselves. Let us start with some bitter things. Homeopathy doctors rarely believe in homeopathy, with few exceptions. Rather, people believe in homeopathy more. Students rarely believe in homeopathy. Homeopathy doctors, homeopathy students know the best homeopathic medicine for fever is paracetamol. Let us swallow this bitter pills from the very beginning. Then only most probably we will able to find out where the wrong is, where the shoe is pinching, as Dr. Bora is telling, that clinical approach where we are failing, why students are not interested or not getting confidence in homeopathic practice, or confidently unable to practice homeopathy. That is the basic problem. Most probably that we are unable to understand materia medica properly. That is one. And another word for Dr. Bora. Dr. Bora has told Dr. Sarkar what is Calcutta School of Homeopathy. At least you should introduce. Doctor, with due apology and honor to everybody, you know so many schools in homeopathy. Even in your place also, I am not mentioning predictive homeopathy, then sensation homeopathy, then classical homeopathy, then school only on mental symptoms. This type of cockeye or the groupism or the seclusiveness among the homeopath only because we never gone through the organon of materia medica. Most probably Master Henneman has told very nicely that where you have to take the sensation, where you have to take the mental symptoms, where you have to take only PQRS, that is uncommon peculiar characteristic symptoms. Some doctors, they are practicing only on that, some doctors are practicing only that, but especially the junior doctors, I am telling, until and unless you know all the schools from your heart, the real meaning, where you have to take modality, where you have to give more importance on the physical symptoms, where you have to give more importance on the mental symptoms, most probably you will join homeopathic seminar and ultimately you will forget everything. Let us see. So, let us be very practical. I will try my level best to give the clear-cut conception of some few medicines along with some rare indications that what patient behaves in our clinic and how we can convert into the materia medica language and repertorial language. And more you will use this, more you will be confident, and confidently you can prescribe materia medica. Especially I have seen just before starting, most probably you have heard name of Dr. Dubey, Dr. P.C. Pal, he was the teacher of the teacher. So many times when I was a student, I have seen that sometimes in OPD, Dr. P.C. Pal has entered, give Calicut, देखिए, give Dalkamada. it is not a joke. It happened, and more we know or more we understand materia medica, more we able to prescribe in that fashion. I will give some examples on that. Doctor, remember this, most probably this should be our motto. When I listen to something, I forget. When I see something, I remember. When I do something myself, then only I understand. Until and unless you do yourself this seminar listening, it is simply wastage of time. Now, as a homeopathic materia medica, as we are telling, it's a naturopathic science. Just you see, things in nature are words and color in form, a language which expresses itself to those who can read. You have to read the language in which patient is expressing his problem or her problem. So you have to understand that this language. Just I am telling, definitely I will show you that how, if you understand materia medica, I am just eliciting a case of Dr. P.C. Pal. That time I was a student of, I think, that time I am doing my RMOship in Calcutta Medical College. A simply patient has entered, and Dr. P.C. Pal, he was the teacher of M.M. Dotto and teacher of Dr. Dubey. Actually, so much arrogant, so much obstinate, and so much rigid personality. Even Dr. Dubey, he was associated with more than 40 years. Then also when P.C. Pal entering, just to imagine that Dr. Dubey was that time more than 6 years old, he stand up like anything. He's just shivering in front of him. So P.C. Pal is just a boy, 9 or 10 years old, coming for eczema. Just you see, he has some penetrating eye. It was rainy season. Just looking, only looking. Then he has very good. Beta, de dao. Kya dega? What yeah, you give medicine. Kaun medicine dega? Then M.M. Dotto also, you know, he is also another good clinician, and he was associated with Dr. Pal for more than 40 years. Though he was that time senior to Dubey, and he was the head of the department of materia medica. As a RMO, I am asking, sir, what I have to give? Because nobody had 10 head that he will ask to P.C. Pal, sir, kya medicine dega? Then also I go, okay, give dalkamara. Now just to imagine, he has not uttered any word, and he is prescribing dalkamara for skin diseases. Any idea? Pardon?
Change of weather.
But Dr. Saab, change of weather, we have thousands of medicine. Is it not? Even if you say rainy season aggravation, Rustux, Maxol, Pulsatilla, Kelisal, Thuja, Arania diadema, all antipsychotic medicine has rainy season aggravation. Anybody has Alan? Somebody has brought, no? Okay, ठीक है, I will show you. देखिए जे कैसा, even without asking how, in other words, how they have grasped the essence or beauty or the keynote or essence of that particular medicine. Allen keynote, second page, first line, excessive secretion of the mucous membrane. So what we are observing, that definitely it is covered with some bandage. Okay. Now the water is pouring out of bandage. Now it is wetting the floor. Excessive secretion, excessive secretion. Increased secretion of the mucous membrane. So what he is observing? No, the child is standing and the discharge is not only wetting the covering, now it is pouring like water. Then he told, doctor, a rainy season and excessive mucus secretion, that is dalkamara. So this is the beauty of observation. This is the beauty of analytical thought. This is the beauty of masters, that how they have grasped the essence of our materia medica. Very frequently I have seen, after prescription, suppose you have prescribed a medicine very nicely. Oh, you take this medicine 4 times a day, then placebo, over this next 7 days, then placebo. Understood? Yeah. Sir, in which way I will take the medicine? Oh, then again that lady is coming, sir, in which way I will take the medicine? I have seen several times Dr. Dubey reject the medicine and instantly write down anacardium 200, acute forgetfulness. Okay. So